Superior means towards the body or upper body part, while inferior means away from the head or lower body part. And for animals, it's cranial and caudal. Anterior means near to and in the front of the body. That's for humans, while for animals, it's ventral. Posterior means towards the back of the body or near to it for humans, while for animals, it's dorsal. Medial means near to the midline of the body. For example, the ulna is on the medial side of the forearm, while lateral means away from the midline of the body, such as, let's see, the radius is away from the midline of the body in the anatomical position. The next two terms are used for appendages only, legs and limbs. These are proximal, which means nearer to the point of origin or attachment, such as the humerus is proximal to the radius. And distal means away from the point of attachment or origin, such as the phalanges are distal to your carpals. I will talk about superficial and deep. Superficial means towards or on the surface of the body. So superficial, such as the muscles are superficial to your bones. Deep means away from the surface of the body, such as your arm muscles are deep to your skin because they're under your skin. Parietal means pertains to or forming the outer wall of a cavity. Parietal pleura forms the outer layer around the cavity, while visceral means pertains to the covering of an organ, aka the first layer before the parietal pleura. Thank you. I will now talk about the different body cavities. There's a dorsal cavity, which consists of the cranial cavity and the vertebral spinal cavity. There's also the ventral body cavities, which consist of the thoracic cavity, the pleural cavities, which is the left and right lungs according to the person, and the pericardial cavity, which is your heart cavity. And then there's the abdominopelvic cavity, which consists of your abdominal cavity, which consists of your liver, stomach, and intestines, while the pelvic cavity consists of your urinary bladder and the uterus for females. Next up is your cephalic, which is your head, and that consists of your skull. Next is your face, which is your frontal, which is your forehead, nasal, which is your nose, and oral, which is your mouth. Buccal is your cheeks, and then your cephalic regions, or your head regions, include the orbital, which is the eye socket, the ocular, which is your actual eyeball, the mental, which is your chin, and your otic, which is your ear. And then the cervical is your neck, and another word for the neck is the nape. Next up is your philtrum, which is your lip gap. Then there's the mental cleft, which is your butt chin. And then next up is the helix, which is your upper ear cartilage. And after that is your tragus, which is your ear flap. Let's see, trunk. Your trunk consists of your thorax, the key to your chest, and consists of your nipples and your pectorals. There you go. Abdomen pretty much is the navel or umbilical cord. Next up is the pelvis. I will not demonstrate it since it's inappropriate. Your inguinal is pretty much your groin, and your pubic is your hairline. And little that crest is pretty much your hips, and your lumbar means your lower back. While your gluteal means your buttock, while sacral is pretty much the triangle near your butt crack. Next up are your upper extremities, which means your arm. Your axillary is your armpit, while your brachial is your upper arm. Antebrachial means your forearm, and your carpal is pretty much your wrist. While your hand is made up of the metacarpal, which is your palm, and the digits or phalanges, which is your fingers and your thumb. While the femoral is your thigh, while the patella is your kneecap, and the gastrocnemius is your calf muscle. Next up is your pedal, which is your foot. It consists of the ankle, which is called the tarsal. It consists of your digits and phalanges, which is your toes, and the calcaneus, which is your heel, and your plantar, which is your sole. Next up is your abdominopelvic quadrant. Let's see, there is the right upper quadrant, there's the right lower quadrant, there's the left upper quadrant, and there's the left lower quadrant. And then the horizontal line is through the umbilicus, and so is the vertical line, which is through your umbilicus. Abduction pretty much means movement of the limbs away from the medial of the body, while adduction means movement of the limbs towards the midline of the body. Thank you. Next up is your occipital protuberance, which pretty much is the muscle attachment at the back of your head. Next up is the temporomandibular, which is in front of your tragus and the gap that opens and closes when you open and close your mouth. Next up is the 7 vertical vertebrae bifid process, which pretty much is the goblin bone, top of your forehead, like right here, the top bone, some that sticks out. Next up is the suprasternal notch, which is pretty much the gap on top of your sternum between the two clavicles. And then the xiphoid process, which is right under the medullarium of your sternum. Next up is the coastal margins, which is pretty much the edge of your ribs to the xiphoid process. Next up is the medial epicondyle of the humerus, which is pretty much located on the thumb side, right about here, since it's medial, close to the midline of the body. The next one up is lateral epicondyle of the humerus, which means it's on the thumb side, since it's away from the midline of the body, right about here. Next up is the olecranon process, which is the actual elbow itself. One last thing, I forgot to mention the head of the ulna, which means this bump right here. Remember, the ulna's on the pinky side, so there you go. That is the head of the ulna. Next up, I'm going to talk about your pelvis, which consists of the iliac crest, which is your hips, your coccyx, which is your tailbone, and your gluteal cleft, which is your butt cheeks. And next, I'll talk about the leg. There's the patellar ligament, which is the one doctors say to test your reflexes. And the next one is the tibial tuberosity, the area where the ligament goes, which is like right here. And next up is the head of the fibula, which can be found right about here. Next up is the lateral malleolus of the fibula, which can be found in the big bone on the pinky side, while the medial malleolus of the fibula can be found on the thumb side, the big bone right here. And next up is the calcaneus, which is your heel, which is the U-shaped bone found right about here. And next, the last one is the Achilles, which is pretty much right here. It's a piece of muscle right here that supports the whole body. Thank you for watching.